with my name is Kath Lovett and I've got Patellar syndrome, and I don't say that very often. I don't know about everybody else. I think the most common question that I think everybody can probably relate to in this room is, do you bite your nails? How many people get that question thrown at them? How does that make you feel when you get that thrown at you?
You have to go through the same rigmarole over and over again, and they look at you and just say, oh, you're a bit weird.
I don't know whether to call it an illness, a condition, or what to say. I've got this thing.
I can't even drive my car if I've got a stranger sitting beside me. I get in a faffle. Honestly, my hands are like this round the steering wheel, and I can't hold a book on a train, a plane, because I've got this thing that they're looking.
Yeah.
And in fact, Joe only said yesterday that when he's at school and people say to him, "Oh, what's that?" he gets all in a fluff, and that's normally when he drops his phone or drops his iPod because he's trying to hide his.
Yeah.
I did see one of the kids yesterday evening. Clearly amongst friends, but he still holding himself like that, so hiding.
Yeah. I think the thing that I said, particularly to Brian at lunchtime, when I saw everybody coming in today, normally in my everyday normal life, I go to work, I go home, I do tea, I go to bed, get up, do the same thing Monday to Friday. And to me, I've got the aches and pains and whatever, but I push that to the back and I carry on as normal, and I'm normal like everybody else. And then as soon as I'm with you all, I suddenly realise, it dawns on me, because I stand just like you stand, just like Toby stands, and just like everybody else stands, and I do things with my hands, just like you all do with my hands, and I don't notice that around me when I'm at work in my office.
But that's normal to us.
But that's normal to us, and
But it's
this
somebody
morning
like
I really felt quite
obviously
choked up.
Jan's got it, and I haven't got it. But until you come to places like this, you think it's only at home. But when you come in and you see everybody, like you just said, you realise other people walk like Janet, other people do what their hands like Janet, and you don't realise till you come and see people, do you?
No.
It's nice being able last night to be able to stand at the bar with a drink, and not, because I normally hold my glass like that, with my glass close to me.
That's it.
Things, and it was so nice, to, amongst strangers really, to be able to not,
It's like my lad, he won't wear shorts off his knees.
Yeah.
If he's not wearing tracksuit bottoms, even at school, he just off his knees are different.
Yeah.
It's been great sitting next to Claire today, because
more
I've just
conscious with women than with men. Especially your hands. Women feel more about hands, nails, makeup, things like that. Men, it's never bothered me. I don't hold my glass anymore. I don't bother if people see it. If people ask me, I'll just say it's a genetic disorder, and that passes it. All through my school days, people just never noticed. It's never been a problem.
Through it, and what about everybody else through school days? Did they ever get bullied because of the condition? You did.
Biting my nails. My mum and dad went up to school constantly, because you will see me sitting there nibbling on my nails, but it's not that I bite my nails. I don't bite my nails at all, but I always try and keep them as short as I can. But even keeping them short, you get the little catchy bits, so you'll be nibbling them, and the next thing you know, I was in the days when, I don't know if it was just that school or whether it was that era, but if you bit your nails, your parents got called up for biting your nails. I don't know, when I think about it now, actually it's a bit bizarre, but I remember my parents being called up the school because I was sitting in class biting my nails. And they had to go through this whole thing, she's not biting much because she hasn't got a lot to bite, really, to be fair.
But how did that make you feel?
I struggle as much with it now, my nails, with all the aches and pains, with all the operations I've been through, all that. The only thing that bothers me with nail patella is my nails. Nothing else. My knees don't look great, but doesn't bother me. The aches and pains I deal with, the surgery I deal with, but my nails, I've still got such a bad hang up. I get really upset. My daughter comes home from uni, she says, I'm just going downtown to get my nails done. Coming downtown with me, mum. I go, no, I'm not coming. I can't cope. I can't cope. Sitting in the nail shop with no nails, I'm like, oh, it's awful. I can't stand it.
You've tried false ones, but they won't stay on.
Stay on for about an hour.
Yeah.
Go like that, they've gone.
Yeah.
I was offered an operation.
Can't you flush the toilet with them on there? They disability in themselves.
Well, I had mine done.
I don't know how people wear them, I do.
When I got married, I had mine done. I thought, oh yeah, I was really excited. And they fell off, and they cost me an arm and a bloody leg.
Yeah.
Million nails, and I was like gutted, absolutely gutted. It's my hands that I'm more conscious of, not my nails.
When you say your hands, what do you mean?
The swan necking.
Yeah,
If I'm pointing, I'm consciously like going, oh my
pointing
fingers not straight.
somewhere else.
Yeah. Someone's going to see my fingers not straight and think I'm a wicked witch or something like that, you know. But that bothers me more than what my nails do, you know, so.
It's a bit awkward giving directions because you point with your arm, you're saying one thing and your hands is doing something.
Your arm's pointing one way, your finger's pointing another way.
And at what age are people going to stop saying, are you pregnant? I mean, are they still going to say it when I'm 70? Are you pregnant? You know, that gets on my nerves, and all. I've got lordosis, but that drives me mad, having to explain that. In the end, I'll just say, oh, I've got a few months left, and I walk away. Honestly, it's quicker just to say, I've only got a few months, and I just walk away than to sit there, explain the whole. It drives me mad, and it upsets me, especially when you've just lost 3 stone, and they still ask you, are you pregnant, you know?
Yeah.
My lad don't like telling anyone he's got a nail patella. When kids ask him at school, what's wrong with your nails? He just don't like saying out to them. He goes through a lot of that.
Yeah, our Grant's 20 now, and he was like, oh, he wouldn't talk about it. Well, still won't now.
Yeah,
Well, it was terrible, that incident, when they like say, the art class, and they had to like draw their own thumb.
Yeah.
It was really bringing things to light, that was.
Yeah.
I never had any trouble at school. I mean, the thing is with me, when I first asked my dad about it, when I was a kid, he just said, you're unique, or special, and as a result, I just put it straight out of my mind, and I just got on with it.
I had a lot of
Nobody ever
trouble at
asked me
school
either.
because I walked so badly, because I couldn't, like, people can't straighten their arms, I couldn't straighten my legs. And I had to have my legs straightened when I was 12. I was in hospital for 6 months for each leg, then those times they get you in bed in a big splint. But I had a lot of bullying because I just, well, it's just zigzagged. If you imagine walking with your legs bent, your bum sticking out, and you're raising your front up, trying to stand up straight. So that was, my legs and my back have been my biggest problems. Now it's depression. Well, I don't know whether depression's attached to it, but I think it can be. With anything you can get depressed, can't you?
You can. Yes, Elizabeth is nodding. I feel with Nell patella syndrome, I know we've touched on ADHD this morning, but I feel that with Nell patella syndrome, it's a completely different type of ADHD.
There is some evidence of a link with depression, and that's sort of supported by what we know about the gene in its role in brain development. But it's always worth bearing in mind that 1 in 10 of the general population have proper clinical depression, and also if you've got a chronic condition that gives you symptoms. So I wouldn't want everyone who's got NPS to think they're going to get depression. But there's lots of causes of depression, but there may be some evidence to say that it might be slightly more likely.
Because we've got just cause to be depressed.
Well, my cousin's been not that long ago. It's my aunt who's got Nell patella. Her son's got Nell patella. He's got leukemia as well. But his son John has got. Well, for years I didn't think he had Nell patella, but he had severe depression that he was never able to go to school even as a very young child. He was always home tutored, very inwards. Found it very hard to socialise because his depression was that bad. And it was only because my aunt was actually sectioned. She's got nail patella. She was sectioned in her 20s with severe depression, and she still is treated now in her late 70s. My dad suffers with severe depression. I've suffered with depression. Everyone in my family that's had nail patella, I mean, again, I'm not saying that it is, but everyone in my family has suffered with it. And then there was John, who, as far as we know, didn't have any nail patella, no health problems at all apart from this. And he actually got genetically tested. Perfect nails, perfect knees, slightly funny elbows, but I mean nothing that you would have said that's nail patella, and it's come back that he has got nail patella. And it was only through the severe depression and having never been able to, never worked, never gone to school because his depression was that bad, and they've picked up on the gene. He's got nail patella syndrome. So, I don't know. Certainly looks like that in my family, that it hits everyone.
Yeah.
The trouble is that there's so many variants of it, though, aren't there?
There is.
You know, because I mean, when I was a baby, Dr. Rennick came to visit me, and got quite pally with my dad at the time. And when he was talking to him about it, he said that really he was more interested in people with A or B blood types, because that seemed to have a more severe case of nail patella than if you had O blood type. Or that's what he was. That's what he was looking into at the time.
So what he did, and I've got his PhD thesis actually from the British Library. He was I think he was the first person to link 2 or 3 different genetic conditions. And so what his study showed was that blood group tends to track through with nail patella in the family. So they tend, you inherited the same blood group with your nail patella syndrome through a family. So rather than your blood group predicting whether you'd be mild or severe, your blood group was predicting in your family whether you would get nail patella or not. So he was certainly looking into the ABO blood group, but it wasn't predicting the severity of the nail patella. It just showed that those 2 genes were very, very close together on chromosome 9 at this 9q34. So that's what that was about. But his work was very important in genetics generally.
Yeah.
Well, that's very interesting, because I got my NPS from my mother, but we've got different blood groups.
So
she's an A, I'm an O. My sister is the same blood group as my mother, but she didn't get the NPS, so that's just not fair. My sister should have had it.
So that happens in genetics when they are very close together, but they're not exactly close together. So what you've had is what we call crossover.
Yeah.
So there's been a bit of a swap from one chromosome to the other.
When I was 17 and only looked about 13, I picked up one of my brother's cigarettes, hoping it would transform me instantly into something taller and altogether more like Ingrid Bergman at the end of Casablanca. And I was so horrified by the shape of my hand that I never took up smoking. Not my nails, because apart from my thumbnails, I've got good nails, but the strange shape of my fingers and the sort of knobbly bit on my wrist. I don't want people seeing that. So I did not take up smoking because I didn't want to draw attention to my hand. So that's a positive result of having NPS. Because otherwise I might have been smoking.
I never thought about that.
It didn't work for mum either.
No. How many people are in here that have got children that have got nail patella syndrome? More or less everybody. We're all nearly there. When you had your child or children, how did you feel?
Devastated.
Knowing.
Devastated.
The first son,
we were told we couldn't have it. We were told it couldn't be passed on.
So
when my first son, who's 30, hadn't got it. So when we had the second one in the ad, it was the biggest shock in the world. We were told to go out.
I specifically asked the question 30 years ago, and I was specifically told no, I couldn't pass it on.
Yeah.
And did they know it was nail patella syndrome?
He did, yeah.
Oh, yeah.
Knew the nail
Yeah.
And he was the most well-known gynaecologist in Stoke-on-Trent.
We were assured it couldn't be passed on.
His wife was my GP.
With it, I didn't know what I'd got. My mum just used to say it just the way you were born, the way you laid in
Way
the
up,
womb.
yeah.
Yeah.
And that was it. So until Karen had problems with her knees,
Yeah.
and that's when we found out what it was.
How do you feel yourself about having a child passing on that condition to that child? Do you get feelings of guilt?
Yes, you do feel guilty, 'cause
Yeah.
especially as you get older and you get more problems. You know what's they've got to come,
Yeah.
and it makes you feel guilty then.
That was why I was so adamant to have the test done to see if Dylan had got it or not. Just for the fact that I wanted to know, because Mum was born with her leg twisted round. And I am going to put it on Facebook. I'm going to scan it and put it on so everybody can see.
My toes were pointing backwards.
Yeah, and I just wanted to know that if Dylan had got it or not, so we could face it as a family and, you know, deal with it. But, you know, luckily,
Naddy.
I don't know. Oh my God, he's absolutely fine. But it's put me off having any more because I don't think I could put myself through it again.
No.
You know what she's gone through and obviously what I've gone through. I couldn't do it again.
I think my trips to Great Ormond Street, when we go to Great Ormond Street, I think Chris feels more angry about, I don't know about me passing on the condition, but I think there's been times when you
I sometimes question why parents would want to inflict the possibility onto the next generation.
Yeah.
But because I've lived with it, I remember when he was born and saying, what's his nails like? Because I knew I was having a boy, I was going, what's his nails like? And I know this might sound really wrong, but I almost sort of chuckled to myself, oh my God, he's got no nails. You know, he's got it. You know, I don't feel guilty for passing it on until Joe says to me every now and again, and more so since he's been diagnosed, well, his arthritis has really flared up, so he's started having injections in his joints, he's had them in his toes, his fingers, and that's probably been the hardest bit. Even though he's had operations, watching him have these injections in his joints is not pleasant, and he often comes out going, why did you have to give birth to me? That's the statement he often comes out with, why did you have to give birth to me? And you know, that makes me feel bad.
What
you
do
know,
you say to him when
you're special, you're special. And as I was going to say, we go to Great Ormond Street, the worst clinic we have to go to is the ophthalmology because it's in the same clinic as the cranial clinic. And I look around when I'm in that clinic and I could cry, and I sit there and I think, now Patella's nothing. Now Patella's nothing in comparison to what some of these parents are living with these children that have got one eye that's stuck in the middle of their forehead and their head's completely disjointed. And that puts it into perspective for me, and I sit there and I say to Joe, you know, a few injections, aches and pains, no nails, you know, or living like that. And that brings it all back to me, and I think, you know, I don't feel guilty too much.
I'm glad you said that because I've been thinking along those lines, and compared to most people I know with huge medical problems, it's been in my family for a long while. My second son has it, my father had it, his sister, one of his sisters, and it goes way back. We've traced it back to at least the 17th century, and we've all led productive and long lives. And you know,
you see somebody worse than yourself at hospital.
I realised at the last conference and at this one, you know, that although we have a great number of the manifestations of it, we probably haven't been as handicapped as a lot of people are with it. So I have to be very sensitive to the way it affects other people. But it was good to hear you say that, because you do sometimes need to reflect on exactly how much we can do and how healthy we actually are.
Just speaking from experience, I have two daughters. My eldest is nearly 20, which is a little bit scary. And Rosie, that you've probably seen wandering around at lunchtime, she'll be 18 at Christmas. Rosie is obviously the affected child. Alice, when I had Alice, I was overjoyed that I'd produced a child that hadn't got the syndrome. But as the years have gone by, probably about 3 or 4 years ago, Alice went completely within herself, and I couldn't quite figure out what was going wrong. And after lots of talking, she admitted to me that she was very jealous of her sister, because her sister gets attention because she's got this condition where she can't straighten her arms, and she was also very thin. And Alice was very, very uncomfortable with the fact that she'd got a completely normal muscle structure, which I would probably kill for. And Alice was so depressed at the fact that she's got this normal body and there was nothing wrong with her, but Rosie had got a completely different body. I don't want to use the word abnormal because that's not right, but had got a different body to her, and Rosie created more attention from people because Rosie was always asked how she was. Has anybody else had that experience as well?
Had the opposite.
The opposite.
We've two, one with and one without. One with has never been treated any different.
Yeah. Well, you see, like
she doesn't view herself as having anything wrong with her.
No.
You could. Our Grant's got it. He's 20. You can't convince him he's got it. He won't accept it.
It's too big deal.
No big deal to him. He just gets on with everyday life and does what everybody else does.
Yeah.
But he's got it.
Yeah.
You know. But he doesn't look at himself as if he's got it.
No.
You know.
My eldest is 20 and she hasn't got it, and you know, and we always said out the two of them, she's obviously not having it being a girl, now. But at times when Joe's been really poorly, she's turned around and said, you know, wish I could take it away from him, you know, wish it was me sometimes and not him having to go for it when he's been on low times. But no, she's.
We get that from my daughter.
I think we tend to fuss over our son who has got it a lot more, and his sister does notice that as
She's
well.
younger.
He does get a bit more attention, I suppose, because of his condition, and I think just naturally as parents you tend to do that, don't you?
Someone's poorly, you give them more
Yeah,
attention.
and she does. I think she does feel it. Definitely, there's definitely a bit of something there. She knows that we're doing that, we're fussing over him more. We probably don't care about him more than we do for her, but she gets that sense that we do.
When his knees are hurting or his back's hurting, he gets a bit more, and she feels it.
I think there is definitely that feeling.
But one son calling the other son Golden Boy once, I don't know what that meant.
yeah, that's right, yeah.
Hey, for something, but no, not really big problems, because I've got one with and one without.
I mean, there hasn't been any difference really between the two. Yeah.
Do you think it makes a difference if you have a diagnosis? Because we didn't have a diagnosis till our daughter was about 16. She just had funny fingers, like.
When she was born, we just got them to look at it. What's wrong with your finger nails?
Yeah, we did ask.
And they said, like, and they were identical to mine.
Yeah, so we knew she had
But
something.
we had never heard of nail palsy.
No, the paediatrician
So we were
just sort of
curious.
said it was one of those things, you know. And we just
And I'd
carried
never
on,
really
thought it was
suffered,
normal.
so we weren't bothered. We were
So
curious.
we didn't know there was anything. It was just we didn't know it was a syndrome, did we?
No, we had no
So-
idea. We just put it down to one
And
of
then
those
we had a
things.
son who was
Perfectly
had
normal.
fingers like mine, and they were just both the same, weren't they? Really?
That's right.
Odd
Never-
things she couldn't do, but that's children, isn't it?
So
Never thought any reason
she
why
never
she
bothered
couldn't do
about
odd
it.
bits.
We didn't
Things-
bother about it.
No.
So,
So
certainly
maybe it was
have no
because we
guilt
didn't
around
know.
it.
You
Yeah,
don't
that was
know,
ignorance.
you know.
Yeah.
Maybe you treat it differently when you don't know.
Yeah. Going back onto children again, I'll just share with you an experience. I don't know whether I can pass that bit of experience on. When Rosie started at the comp, she's always had problems with her handwriting. That grip of the pen has not been able to straighten your arms, so you're using that motor from the shoulder and you're getting arm ache, and her writing gets very spidery and very untidy. She always used to get lots of comments about can't really read your homework, and my concern was if she can put the information down on paper but maybe it's not quite, if you can't read it, then there's obviously going to be a problem with her grades.
She was going to be a doctor.
That's a very good point.
It's all the prescriptions now, because we couldn't read the writing.
So I went to Rosie's school and said, you know, maybe you can help my daughter, you know, improve. You're all commenting about her handwriting. Can the school provide her with a laptop? I felt as a parent that that's what the Education Authority should be doing, was to be helping my child in school. And it shouldn't be down to the parent that has to go out to PC World or wherever and go and buy them a laptop that can get wrecked in school when the school could probably provide one. And the school came back and said, no, go away. And I didn't think that was acceptable. And as she got a little bit older and the years were going by and we were getting near to when, you know, exams, as in GCSEs, were coming up, I went back to the school again and asked them the same question. Can you provide my daughter with a laptop? You know, because you're all complaining about her handwriting, or she's taking too long in class to try and make her handwriting look a little bit neater. The answer came back as no, again. So I got a bit of a bee in my bonnet, and I think as a parent, when it concerns your child, you do tend to start fighting your child's corner, and I get a real, I've got people nodding at me over here, I get a real burning passion in my stomach.
Got one of you.
So I went off to see, I made several phone calls and I ended up managing to get an appointment with the local education authority. And I sat down and I explained, and I took all of her school books with me to show them, you know, how bad her handwriting was. And I became Rosie's sales rep, really, I suppose. And I think this is what you have to do with this condition anyway. You've got to sell yourself, haven't you? You've got to sell that condition to convince that consultant who's going to be what you've got. But I'm going off on the beaten track as usual. But anyway, the be-all and end-all of it was that eventually, after a 3-month fight with the local education authority, they provided Rosie with a laptop from the education authority, not from the school. And by then I'd already changed schools with Rosie. I'd moved her because I just thought, why would I want to put my child in an institution where they're not really interested in helping her, you know, when she's clearly struggling and it's causing her pain to write and they're not interested. Can you get my daughter a laptop? No. The difference in schools from moving from one school to the other school was incredible. And in a way, I suppose, the school that she's at now, where she moved to, they were the most helpful people I could have gone to at the time, when I thought, right, you know, if they don't want to help, let's go to a different school and we'll tackle it from a different angle. The lady there said to me at Rosie's school, has anybody ever written a letter to say that she really does need something to help her with her schoolwork, either to do her work on a computer or a laptop? And I said, no, they haven't. Can you get back to a GP or a consultant and get that letter? Yes, I can. That letter was that golden ticket. As soon as I had that letter, that laptop was with me within 5 days.
Shouldn't even have to get these letters.
You shouldn't.
I mean,
No.
we haven't. We've had no
Yeah.
problem. As soon as he started secondary school, we said, you know, in fact, the OT at the hospital had done an assessment on him, and they time how long he's writing for, and you know how his writing changes. Without anything, I don't know how many times he's had to use it. They've given him a smart something, like a laptop, some kind of thing they've given him. He's got a card with 25% extra time, so as soon as he's got a test or assessment, but it was just given. He come home with his wad of, you know, red cards if he has trouble in PE, a blue card if he has trouble because of his this, and if he needs to go to the toilet he shows that, and he's got this wad of cards in his pocket, and yeah, I mean, it is
like he's in a
mad.
good
It's just
place.
yeah, but
Yeah. Sounds
so
like
you
he's
get
in a
to
good
get a
place.
letter.
That's people taking an understanding of what's going on, isn't it? That's people taking the time.
Why should we need to speak to doctors? I mean, at the end of the day, you know, you've got to be a pretty sick parent to go into a school and pretend your kid's got this, that and the other to want to have a laptop, or to want to get out of PE, or to get out of class. You've got to be, you know, I expect there are parents out there that are like that take advantage of situations, but who knows our kids best? You know, even from the specialists.
Yeah.
Like you say, it's different varies. Your
That's right,
child
yeah.
and NPS and my child with NPS are very different.
Yeah.
Why, you know.
It's good that that's available though, that you can actually get that even though it's hard to get. It's good that that's available. And I know I used to walk to school with textbooks because there's no lockers, the big rucksack, walking over the school PE kit and everything, and fall over all the time on the way and get, you know, make taken out of me. You make light of it, which we did, and it was all fine, but when you look back, it's not right, is it?
No. It's important in the childhood when they're going to school. They mess up in the childhood, they can carry on later on in life.
As well, isn't it?
It's
What it does to them.
Taxi to school provided by the local authority. They picked me up in the morning and brought me home.
But it's all things like that that when we talk about depression, I think that's where it can stem so early on in life, can't it? It might not necessarily, like we say, be a genetic link, depression and NPS, but it's all these little things at school, you know, not feeling that you can wear shorts because your knees look different, not being able to write neatly, and people commenting, even the teachers commenting, you know, on your daughter, or you write. What that does to your you know, the self-esteem. You know,
I'm really worried about transition now to secondary school, because primary is fine, it's just.
But you know what, I mean,
secondary's a whole different ballgame, isn't it?
We went in there and we said, right, our son's got a condition, it's very rare, you won't know anything about it, can we call a meeting? We called a meeting, there was us, there was the head of year, there was pastoral, there was the Senko, and even Joe's physiotherapist and occupational therapist agreed to come along to the school, and we all sat, and you know, so the physio told them what he should be, you know, what they should be looking out for, and I think it's been pretty productive, you know. So I think it's about getting in there early, getting any literature you can, and giving it to the school before he goes in, and say, look, before he starts the school, this is what he's got. It's important that you know what it is.
But still, you need to be aware, because I work in a school. You still need to be aware that all this information may be transferred from the junior school to the senior school.
See, I've had
but the teachers won't necessarily be told everything.
Yeah, I'm a teacher myself as well, so, but my son is, every year I'm having to go in at the start of a new year, because within the same school they're not passing the information on as well.
So Joe's school have got a system now where his IEP, or his latest care plan, like obviously because it's changed since he's had this diagnosis of Crohn's, and he's been ill for a couple of years now, his situation's changed, so they've had to be aware of different things. But apparently they all take their own laptop into their classrooms with them, and they've literally got the information is typed on from the head of year, so it's on every class that he goes into. They've got the list of all their students, and if there's any issues with that student, it's up on their screen, so they're reminded, you know, because like say, a supply teacher comes in, he holds up his card, wants to go to the toilet, or that he has to stand up because his knees have gone stiff, and boom, it's, you know, it's a detention at the end of school because they don't understand.
Cool. I think it's definitely a good idea that what you did at the start.
But also, the Senko from the primary school can arrange to have a meeting with the Senko at the secondary school as part of transition, because that's one of my jobs. I used to work with transition, primary to secondary.
I asked for him to be put on the register just to flag him up, but they said he didn't.
Is he not on School Action or School Action Plus or
and
anything like that?
Well. But he's not. They wouldn't put him on the register because there's no real need, really. Just because it's a condition, it doesn't need to be on the register.
But did you say he's got problems with his knees? And he should at least be on the lowest.
We do at my school with any child with a medical condition is put on the register to flag them up, but not at this school. But I'll definitely do what you've said, hold a meeting before transition. So that's a really good idea with a lot of the head of year, young teachers, course. We don't have a lot of involvement with physio.
When Rosie went from primary to comp, I did exactly the same. I called the meeting, except school was rubbish. So.
They do vary, don't they? The Senkos in each school, you know.
They do. Anybody here that's a first time attendee at a conference?
Me.
Had you met anybody else apart from your own families?
No.
How did you feel walking in today? Just
Not
wanted
that
to ask that
overwhelmed,
question.
really.
I just thought I'd ask that question because there's always that fear of, I remember going to the first conference years and years ago. Janet and I was talking about that last night, you know, in Bridlington about 15 years ago, and just standing in the doorway just going and not being able to move for about 10 minutes, and I glanced around the room and looked at people and just thought, wow, he looks a bit like so-and-so, gosh, and you look so like my nephew, but he's 28 now, so he's a lot taller than you, but wow. Why is that, Elizabeth? Can you answer that one?
You look something like John. A lot of people, with a lot of conditions, there are similar facial appearances, and nail patella syndrome hasn't been felt to be one of those, but I think that as well as, you know, affecting the way the bones and the joints in the sort of the arms and the legs and the back grow, I think that there are subtle similarities in facial features, definitely.
Yeah.
Not everybody, but you know, I think the more people you meet with the same condition, you can, without looking at the hands, you can actually pick a lot of people out if you know what to look for.
Yeah.
Through sort of similar facial features and as you say, sort of body position and things like that.
Yeah.